Hi, welcome to Professional Certifications channel. Let's break down RHIA exam preparation, one topic a day for focused and effective learning. Today's topic is healthcare proxy, a key role in medical decision making.
1. What is a healthcare proxy? Let's start with the basics. What exactly is a healthcare proxy? A healthcare proxy is a legal document that allows an individual, known as the principal, to appoint someone else, known as the proxy or agent, to make healthcare decisions on their behalf if they become unable to do so. This ensures that medical decisions align with the principal's wishes, even if they cannot communicate them due to illness or injury. A healthcare proxy is typically part of advance directives, which are legal documents that guide medical treatment when a patient is incapacitated. It's important because it ensures that a trusted person, chosen by the patient, is empowered to make critical healthcare decisions in line with the patient's values and preferences.
2. Key components of a healthcare proxy. The healthcare proxy document includes several key elements that outline the responsibilities of the agent and the preferences of the principal. Let's explore these components. 1. Appointment of the proxy. The principal designates a specific individual to serve as their healthcare proxy. This person can be a family member, friend, or anyone the principal trusts to make decisions on their behalf. The chosen proxy should be someone who understands the principal's values and is willing to take on the responsibility of making healthcare decisions. 2. Scope of decision-making authority. The healthcare proxy document specifies the extent of the proxy's authority to make decisions. This can include decisions related to medical treatments, surgeries, end-of-life care, and even organ donation. The document can grant broad authority or limit the types of decisions the proxy can make, depending on the principal's preferences. 3. Conditions for activating the proxy. A healthcare proxy typically becomes active only when the principal is deemed incapable of making their own medical decisions. This determination is usually made by a healthcare provider, who assesses the patient's mental and physical condition. 4. Communication of healthcare wishes. The document may also include specific instructions about the principal's preferences for care, such as whether they would want life-sustaining treatments, pain management, or resuscitation in certain circumstances. These instructions help guide the proxy in making decisions that align with the principal's wishes. 5. Revocation Process. The principal can revoke the healthcare proxy at any time, as long as they are still capable of making their own decisions. This allows flexibility if the principal changes their mind about the proxy or their preferences for care.
3. The role and responsibilities of the proxy. The person appointed as the healthcare proxy takes on significant responsibilities when it comes to making medical decisions for the principal. Let's break down the key duties of the proxy. 1. Making medical decisions. The primary responsibility of the healthcare proxy is to make healthcare decisions on behalf of the principal when they are unable to do so. These decisions can range from choosing specific medical treatments to making end-of-life care decisions. 2. Communicating with healthcare providers. The proxy serves as the main point of contact for healthcare providers, ensuring that the principal's preferences are communicated effectively. This includes discussing treatment options, understanding medical conditions, and making informed decisions based on the principal's wishes and best interests. 3. Respecting the principal's wishes. The healthcare proxy is legally obligated to make decisions that reflect the principal's values and preferences, as outlined in the healthcare proxy document or as expressed during discussions. Even if the proxy has personal opinions about the treatment, they must follow the principal's instructions. 4. Navigating complex decisions. The proxy may need to make difficult and complex decisions, especially in situations involving life-sustaining treatments, surgeries, or other high-stakes medical interventions. In these cases, the proxy should rely on the principal's stated preferences and work closely with medical professionals to ensure the best possible outcome. 5. Advocating for the principal. The proxy must act as an advocate for the principal, ensuring that the healthcare team follows through on the principal's wishes. This can include discussing alternative treatments, seeking second opinions, or challenging recommendations that do not align with the principal's preferences.
4. Why a healthcare proxy is important. Having a healthcare proxy is critical for ensuring that medical decisions align with a person's values and preferences, especially in situations where they are unable to communicate. Let's explore the key reasons why having a healthcare proxy is so important. 1. Ensures patient autonomy. A healthcare proxy allows individuals to maintain control over their medical care, even if they are incapacitated. By appointing a trusted person to make decisions, the principal ensures that their wishes are respected, even when they cannot advocate for themselves. 2. Reduces family conflicts. In the absence of a clear healthcare proxy, family members may disagree on what medical decisions are best for the patient, leading to conflict and stress. By designating a proxy, the principal avoids confusion and ensures that one person has the authority to make decisions, reducing the likelihood of disagreements. 3. Provides clarity in medical emergencies. In emergencies, healthcare providers often need to make quick decisions. Having a healthcare proxy in place allows for a faster, more informed decision-making process, as the proxy can step in and guide healthcare providers based on the principal's preferences. 4. Supports end-of-life decisions. For individuals with strong preferences about end-of-life care, such as whether to receive life-sustaining treatments, a healthcare proxy ensures that those wishes are followed. This can bring peace of mind to both the principal and their loved ones, knowing that difficult decisions will be made according to the principal's values. 5. Legal protection. Appointing a healthcare proxy provides legal protection for both the principal and the proxy. It clarifies who has the authority to make decisions, ensuring that healthcare providers and family members follow the legal guidelines set out in the document.
5. How to choose the right healthcare proxy. Choosing the right healthcare proxy is one of the most important decisions a person can make when planning for their future healthcare. Here are some key factors to consider when selecting a proxy. 1. Trustworthiness. The healthcare proxy should be someone the principal trusts completely to make decisions on their behalf. This person will be responsible for making critical medical choices, so trust is essential. 2. Ability to communicate effectively. The proxy should have strong communication skills, as they will need to interact with healthcare providers and advocate for the principal's wishes. They should also be able to ask questions, understand medical information, and explain decisions to family members. 3. Willingness to take on responsibility. Being a healthcare proxy comes with significant responsibilities, and not everyone is comfortable making tough decisions in stressful situations. The chosen proxy should be someone who is willing to take on this role and can handle the emotional weight of decision-making. 4. Understanding of the principal's values. It's important for the proxy to have a deep understanding of the principal's values, beliefs, and preferences regarding medical care. This ensures that the proxy can make decisions that align with the principal's wishes, even in complex medical situations. 5. Proximity to the principal. While not always necessary, it can be helpful if the proxy lives near the principal, especially if they need to be present for medical discussions or emergencies. However, modern communication tools make it possible for proxies to serve effectively, even from a distance.
6. Best practices for establishing a healthcare proxy. To ensure that the healthcare proxy works as intended, there are several best practices that individuals and their chosen proxies should follow. Let's explore these key steps. 1. Have a thorough discussion. Before appointing a healthcare proxy, the principal should have an in-depth conversation with the potential proxy about their values, preferences, and medical treatment wishes. This helps the proxy understand their role and prepares them for decision-making. 2. Put it in writing. Once a healthcare proxy is chosen, it's crucial to formalize the decision in writing through a legally binding healthcare proxy document. This document should be signed, witnessed, and kept on file with the principal's healthcare providers, family, and attorney. 3. Update the document as needed. The healthcare proxy document should be reviewed periodically, especially after major life changes such as a new diagnosis, marriage, or relocation. If the principal's wishes or choice of proxy changes, the document should be updated accordingly. 4. Share copies of the proxy. It's important to share copies of the healthcare proxy document with the appointed proxy, healthcare providers, and any family members involved in the principal's care. This ensures that everyone knows who is responsible for decision-making if the need arises. 5. Regularly communicate with the proxy. The principal and the proxy should have ongoing discussions about healthcare preferences. As circumstances or medical conditions change, these conversations ensure that the proxy is always aware of the principal's current wishes.
Conclusion. In conclusion, a healthcare proxy is a powerful tool that ensures an individual's healthcare preferences are respected, even when they cannot communicate them directly. By appointing a trusted person to make decisions on their behalf, individuals can maintain control over their medical care and bring peace of mind to their loved ones.